Greetings once again, everyone. What an amazingly beautiful day for new beginnings. Greetings and welcome once again to our annual luncheon. I welcome you today after much reflection on the state of our community and the many challenges it faces in the forthcoming months. As we dance with uncertainty, be it the unrelenting heat and humidity, the overbearing traffic, the incessant implementation of new and overturning of old legislation, or the increasingly scarce availability of funds, we South Floridians must always keep a watchful eye on the bottom line to avoid being caught by surprise. In this manner, the Council is steadfast and always vigilant in pursuit of its vision to become the organization of choice, driving integration, collaboration, and engagement for the improved health and wellness in the communities we serve. With a focus on year 2020, our aim today is to inspire new ideas, ingenuity, and movement towards the creation of a truly resilient South Florida. We currently see our community as one composed of an extremely unique set of demographics, given our diverse cultures, each with their own concepts of healthcare and how it fits into their lives. However, I ask each and every one of you today for one moment, let us just imagine. Let us imagine a place where information and resources flow smoothly through the community, where assets exist to where assets can be best applied. A place where people feel cared for, acknowledged, and yearn to give back to both individual members and their community as a whole. Imagine a place where there is a sense that the community becomes greater than the sum of its parts. A place where community becomes resilient to shifting outside forces and responsive to the needs of its members. A place where neighborhoods are filled with promise, not risk. A thriving community that does not become passive, instead holds a balance of tension to uplift the community as a whole. The Council's vision of South Florida 2020 cannot be realized without the help of the community which it serves, deriving strength in its numbers and collaboration from its many sectors. One of the most crucial of these sectors is education. Only through education will our community acquire the tools necessary to improve the overall state of health of the constituents of this great society. Research demonstrates that people with more education are likely to live longer and experience better health outcomes. The United States is the only industrialized nation where young people currently are less likely than members of their parents' generation to be high school graduates. More education generally means a greater likelihood of being employed at all, and having a job with healthier working conditions, better employment-based benefits, and higher wages. More education can lead to higher paying jobs, which enable people to obtain health care when needed, provide themselves and their families with more nutritious foods, live in a safer and healthier home, and neighborhoods with supermarkets, parks, and places to exercise, all of which can promote good health by making it easier to adapt and maintain healthy behaviors. Parents' educational attainment is linked to their children's health beginning early in life, and their children's educational attainment, both of which influence children's health in adults. The level of educational attainment children eventually achieve also affects the health of their own children, perpetuating a vicious intergenerational cycle of low educational attainment and poorer health. By providing the knowledge and skills necessary to fully participate in the labor force, education can be key in promoting social mobility and in breaking the cycle of intergenerational disadvantages and related health disparities. As per the Robert Wood Johnson Education and Health Calculator, and I really would love for you to pay attention to these statistics because this was really an eye-opening for me, everyone. As per the Robert Wood Johnson Education and Health Calculator, Miami-Dade County, in Miami-Dade County, if 5%, just 5% more people attended some college, and 4% had an income higher than twice the federal poverty level, we could expect to save 712 lives, prevent 8,400 cases of diabetes, and eliminate $107 million in diabetic costs every year. Outstanding numbers, right? Not a big job to do. 5% education, 4% raising income levels. Ladies and gentlemen, we know that collectively we can catalyze transformational partnerships and move the needle towards a thriving community. While preparing for this luncheon, I stumbled upon an amazing video by a gentleman by the name of Taylor Mali, who is a teacher and slam poet, who passionately expresses the need to link education and health. I would like to share this video with you, so I invite you to look at the screen for just a few moments, and I hope that you will enjoy it as much as I did.
But shouldn't the children of the country that's the wealthiest also be the children of the country that's the healthiest? That makes sense. You'd think that would be true. I know I would. I'm just saying, wouldn't you? But that's not the case with our kids these days. Kids' health is declining in all kinds of ways. We need to improve it. We can, and we will. But it starts with thinking of health as a skill, a 21st century skill that you practice. Practice makes perfect. The unhealthy can't hack this. We've got to teach our kids by example every day. And it's tough because people stop listening when they think they know what you're going to say, like drink more water, eat more vegetables, especially the dark leafy green ones, eat less sugar, don't drink soda, especially the sugary caffeine ones, stop watching TV, go play outside, go for a run or a walk or a bike ride, get your heart rate up every day of the week, chew your food more, eat slower, meditate, sit still, get your heart rate lower. Set yourself a health goal. It doesn't have to be wild. It takes a lot of things to raise a healthy child. And healthy kids do better in school. They have better jobs. They lead better lives. They marry healthier husbands and healthier wives. Good health is a skill, and teachers need to teach it. Now you got me preaching, so I might as well preach it. Health is not a one-semester class you take in middle school. It should be a part of every subject. Not the exception, but the rule. Learn about good health in math, in English, and in social studies. Work on a project about nutrition in science with your buddies. And parents need to be involved too. Teachers can't do this alone. Good health starts at home. We need to own this issue because the stakes are high. What does it matter if we try to increase our scores in math and reading if scores are dying before their time because they got fatter and fatter? Healthy students make wealthy earners, not to mention better learners. The choices you make every day have the biggest impact in the biggest of ways. Check it. Why else would they say an apple a day keeps the doctor away? But new solutions to old problems, that's the American way. Who cares about keeping the water clean and pure? There isn't a problem if they can't sell you the cure. Don't keep looking for new technology to be your medical savior. Of course, it's easier to be saved by a miracle than it is to change your behavior. So we need to value health education the way we value math and reading. We can't keep feeding our children the same old lessons like junk food full of saturated fat and sugar and chemicals. We can do better than that. We can and we will. And that's the truth, because the future belongs to the healthy youth. Amen.
Mindful of this powerful message, the Council, with heightened awareness of our community's diversity, continues to develop quality program planning where the holistic approach to wellness and quality of life is utilized to inform efficient and effective care in which psychological, physical, and emotional needs are addressed. To our South Florida community partners, we look forward to what we can create together. Thank you. And now it is my great honor to introduce, and pleasure, to introduce our moderator for today's panel discussion, Helen Aguirre Ferrer, an award-winning bilingual journalist who co-hosts Prohibido Callarse at Univision Radio, the highly rated daily political talk show of WQBA 1140 AM, specializing in news, commentary, and analysis. A political analyst for Univision Network, Destino 2012, covering the national political election cycle on national newscasts. Moderator of the weekly WPBT2 Public Affairs Series issues, reaching audiences from the Treasure Coast to the Florida Keys through the PBS affiliate WPBT2. In print, Helen Aguirre Ferrer is the opinion page editor and weekly columnist at Florida's oldest independent Spanish language newspaper, Diario Las Americas. Aside from her career in journalism, she is passionate about providing access to education to students of all ages and backgrounds. She is the first woman to chair the Board of Trustees of Miami-Dade College and serves on the Board of Directors of the Association of Governing Boards of Universities and Colleges in the United States. Aguirre Ferrer co-founded Operation Saving Lives, which was a humanitarian task force responsible for sending significant contributions and medicines, food, and clothing to victims of Hurricane Mitch in Central America. She was also appointed to the Florida State Committee of Higher Education Access Task Force in 2005 and the Florida Energy 2020 Commission, amongst others. Please join me in welcoming Helen Aguirre Ferrer.
Thank you so very much, and thank you for inviting me to moderate such a wonderful panel. At this time, I'd like to welcome our panel members and ask that they join me on stage as I introduce them. Our first panel member, Alberto Carvalho, Superintendent of Miami-Dade County Public Schools, the nation's fourth largest system. Superintendent Carvalho is a nationally recognized expert on education reform and finance, as well as an outspoken advocate for high-quality education for all students. Under his leadership, student performance in Miami-Dade has improved significantly. In 2011, the district posted its highest high school graduation rate ever, and through a data, let me say that again because a lot of people miss this point. In 2011, the district posted its highest high school graduation rate ever. Thank you. And through a data-driven approach to school performance improvement, decreased the number of F schools in Miami-Dade from 13 to 0. A leader in innovation, he is spearheading the transformation of education, pushing for the migration from textbooks to digital content, and is developing cutting-edge educational environments to meet the demands of today's learners. Please join me in welcoming Superintendent Alberto Carvalho. University of Miami usually gets it right. They have as president Donna Shalala, appointed in 1993 by President Bill Clinton as the U.S. Secretary of Health and Human Services, where she served for 8 years, becoming the longest-serving Health and Human Services Secretary in U.S. history. At the end of her tenure, the Washington Post described her as one of the most successful government managers of modern times. I couldn't agree more. As president of the University of Miami, the university has solidified its position among top U.S. research universities. Let me say that again, because we take it for granted, but it's actually a pretty big thing. As president of the University of Miami, Donna Shalala has seen that the university is solidified in its position amongst the top U.S. research universities in the country. President Shalala has more than 4 dozen honorary degrees and a host of other honors, including the Presidential Medal of Freedom, the nation's highest civilian award. Ladies and gentlemen, President Donna Shalala. Our next panel member, demonstrates day after day that there is indeed a better life after publishing. Dave Lawrence is president of the Early Childhood Initiative Foundation and University Scholar for Early Childhood Development and Readiness at the University of Florida. He leads the children's movement of Florida, building an enduring, sustainable movement to make all children the state's #1 priority in investment and decision-making. Prior to working with the children's movement, Mr. Lawrence was publisher of the Miami Herald, and in the area of early childhood and development and readiness, he was a pioneer. He's a member of the Governor's Children's Cabinet and twice chaired the Florida Partnership for School Readiness. He has received 12 honorary doctorates and was honored with Knight Ridder's top award, the John S. Knight Gold Medal. Ladies and gentlemen, Mr. Dave Lawrence. Our next panel member, George Foyo, is Executive Vice President and Chief Administrative Officer of Baptist Health South Florida. His responsibilities include human resources, international services, legal counsel, construction administration, government and community relations, the foundation, hospitality and business relations, and corporate diversity. Prior to joining Baptist Health, Mr. Foyo was market president for Blue Cross and Blue Shield of Florida and president and CEO of the Greater Miami Chamber of Commerce, president of DirecTV Latin America, and president and managing director for ATT's Caribbean and Latin American region. He is immediate past chairman of the Cuban American National Council, on which he continues to serve. He's also on the board of the Greater Miami Chamber of Commerce, Beacon Council Advisory Board of Trustees, Miami-Dade Public Schools Superintendent's Business Advisory Board, and the FIU School of Business Advisory Board, as well as serving as vice chairman of Coconut Grove Bank. Please join me in welcoming Mr. George Foyo. And last but never least, Dr. Ana Viamonte Ross. Dr. Viamonte Ross was Florida's first state Surgeon General and the first woman and Cuban American to serve as head of the Florida Department of Health from 2007 to 2011. Currently Director of the Physician Relations for Baptist Health South Florida, she is responsible for that organization's International Physician Relations Program, the International Business Development of Doctor to Doctor and Medical Institution Affiliations Programs, the development and operations of telemedicine, second opinion and CME programs for international physicians, and the creation of new business originating in Latin America and the Caribbean. Please join me in welcoming Dr. Ana Viamonte Ross. With such a good panel, where do you begin? Well, let's take a stab at it. We saw this wonderful, by the way, wonderful video presentation, which talked about wealth, health, and education, and how importantly linked they are. And if health is indeed a 21st century skill, and teachers need to teach it, how much more can we pile on teachers, and yet how can we afford not to do that? Alberto Carvalho, I chaired a panel that was similar to this in Washington, D.C. a week ago, and it always seems that when it comes to healthcare and education, at least in state legislatures, it's always given as an either-or proposition, as if you can really make that kind of a choice. And yet, that's what happens in the Florida legislature for sure.
Well, thank you so much for the invitation. And if you know Helen, thank you so much for starting with the easy questions first. Since there are legislators in the room, why not? But I agree with you. I think, number one, there are so many needs across the state, so many needs in our very own community, and to put before us propositions that force a selection between the hardcore subject areas and essential programs such as health program, physical education, and let me say it, arts and music programs. Do we really want kids to go to school without art and music as an essential ingredient? I don't think so. So this should not be an either-or proposition. It needs to be a both-and proposition. Obviously, the elephant always in a room as we're making these choices and politicians are deliberating through these issues is funding. And I'm not a political individual, so I'll speak the truth. It's kind of hard to provide all of the essential ingredients that make up for a well-rounded education that provides a safety net for children, preventing them, regardless of the socioeconomic level at which they're growing up, from falling into a life of despair, poverty, and poor health. When you're funding education at $6,000 per year in the state of Florida, when the cost of juvenile incarceration is $36,000 a year. So as long as you have that disparity, we get to understand where the state is placing its priorities, number one. Two, unfortunately, what the end result is. We keep looking at the outcomes, spending little time on the inputs. And the input from the state is its funding, it's its prioritization of spending, and really budgeting what you value. And to the extent that we underfund education, to the extent that we underfund healthcare programs, particularly those programs that serve the neediest in our communities, the most fragile and invisible, we're going to continue to deal with overtime, graduation lag issues, high dropout rate, and a ballooning healthcare cost because we're not investing in prevention. We are simply dealing with remediation at a multiplier cost that I think the industry folks are keenly aware of. And myself, being the employer of the largest workforce group in Miami and second in the state, I too pay, being the biggest shopper of healthcare services in the community. And a lot of those services, unfortunately, are remediation rather than prevention. So we're paying at a premium when the state, in fact, could find better ways of funding preemptive solutions to problems that we are very, very well aware of.
Donna Shalala, as an educator yourself and as former Secretary of Health and Human Services, is healthcare, do we need to look at it in a new way, that it is a 21st century skill set, and how do we get there?
Well, it's very clear that in this community in particular, we need a much more integrated approach to healthcare, working with the schools and with the other institutions in our community to make sure that we've designed our own safety net for the community. Healthy kids are better learners. There's no question about that. And the fact is, healthcare spending is going down in this country. It's going down in our community. But individuals' costs are going up. So we have to be very careful.
Public health care funding is going down.
Public health care funding is certainly flattening out, though the government is about to invest $1 trillion in covering working class Americans in the new health care bill. Whether Florida will take advantage of that, there'll be a national program, but that's another complicated issue. We're about, in a partnership with the Marlins, to try to cover some of those healthcare needs by bringing back a free clinic to Little Havana, for example.
When you say we, you mean University of Miami?
But we need an integrated approach with all of the healthcare providers, which is what the Health Council has really been working to do so that no one falls between the cracks in our community. And that will be the critical element, I think, in the next couple of years. I'd also like to add something to what Alberto said about the kids. We have to be very careful that our education is not too utilitarian. When we're over-regulate the education system and channel a generation of kids, particularly low-income kids, to just job training as opposed to preparing them for their second and third jobs, and giving them a broader education and giving them an opportunity to go to four-year as well as two-year colleges. That's creating problems for us in the long run with people that don't have the flexibility to adapt to the changing environment. So I'm exactly where our superintendent is on making sure we preserve the humanities and the social sciences and physical education and all the other parts for a total education for our kids. So we're really preparing them, not just for a narrow future, but for a broader future.
Couldn't agree with you more. Dave Lawrence, one of the things that I didn't stress in your presentation is you founded the Children's Health Trust. And you really brought to the forefront the importance of children's issues locally in our community. And not only that, public funding for that entity, which is always easier said than done. When we talk about Vision 2020, and we're trying to look at the resilience of our community, everybody would agree that, of course, healthcare, good healthcare, and good education are important components. But how do we get there? You start with early education, but how do you bring the families along, and how do we merge the different cultures? Heck, that's even hard to do in education alone when you've got pre-K through 12, and then you've got the higher education. How do you merge the different cultures?
Let me start by saying there are two people in this audience, one of them Dr. Judy Schechter from the University of Miami, and another Dr. Andrew Brickman, who with the money from the Children's Trust, we have put health teams, not only a nurse or nurse practitioner, but someone with a master's in social work, because so many of the issues are social, emotional, behavioral, developmental. Those are now in 165 public schools. So if people ever wonder what their money is being used for, that's the kind of difference that it makes in this community.
And hold on a minute. I think that's worth a round of applause.
Okay. So let me respond to your question directly. President Shalala talked about a world where a community where no one falls between the cracks. That, to me, is what we're trying to do. We're trying to build a movement for all children. The same principles that raised my 5 children, the blend of health, education, nurturing, and love, are the same things that all children need and ought to have. And I'm simply old enough that I'm no longer going to accept the answer, we don't have the money. It is a matter of choices. We have a $70 billion state budget. I promise you that it is not hard to get a road paved in the state of Florida. It's not hard to do a whole bunch of things. Here is a country, this is not a political statement. This is a country that has spent $500 billion in the last 10 years to bring democracy to Afghanistan. I'm not even talking about Iraq now. To bring democracy to Afghanistan. And we have 14 million children in this country who do not have the basics of a medical home and health insurance. 100,000 or more live in Miami-Dade. More than 500,000 live in the state of Florida. You'll never do this until you say it is deeply American for every child to have certain basics that give him or her a chance to succeed in school and in life. So creating a movement ultimately is what needs to be done.
George Foyo, one of the things that we look at when we look at the resiliency and these issues, and one of the things that, you know, there's a similar theme that you see of working with the school systems and health. Donna Shalala was talking about partnering with the Marlins to open up a free clinic. Access is absolutely critical. In hospitals everywhere, you see going back into neighborhoods. There are some hospitals that on strip malls, there are strip shops, there are shopping centers. They're opening up clinics to have that access so you don't have to go to the big hospital in order to get your medical needs. But being nearby and making it local is a significant component.
Well, and both Baptist and for example, understand the value of not doing things simply in the core, but spreading them out. I'm not talking about a one-size-fits-all in America. I'm talking about basics for everyone, and it might be delivered in some different ways.
And George Foyo, so when we look at these issues and we see how do you prioritize this so that you actually make the impact in the community?
Well, the 3 major components that we address, one is quality.
A little closer.
Yeah, my voice is a little low today, unfortunately, but
we won't ask you to sing.
I'll thank you. Thank you for that. Quality, access, and cost are really the 3 areas in healthcare that are being addressed not only through healthcare reform, but I think every responsible hospital system in the United States has to be focusing on those three areas. The days of fee-for-service are going to end. Namely, the concentration is going to be on the quality of the outcome. The value proposition is do it right the first time, just like in manufacturing. You know, I grew up in AT&T and manufacturing, and some of the same principles apply. So in the area of access, as you mentioned, having centers, outpatient centers, urgent care centers, diagnostic centers closer to the customer, the patients, facilitates to provide service for those who don't really need to go to an emergency room and other places where they have to wait 3 or 4 hours. The cost of serving those patients is much lower than in the big boxes, as we call them, because the big boxes carry legacy systems, a lot of infrastructure that with technology, because there are many different aspects to this, technology is also giving access to procedures that normally were conducted inside the hospital settings can now be done outside. So the whole healthcare system is transforming itself into being more nimble. The cost issue is one that is very difficult to deal with because it has many different variables. I won't get into all of them now, but it's
How can your organization, as an example, benefit from a closer alliance with educational resources?
Yeah. Well, our philosophy, for those of you who read a recent article that Brian Keeley, where he was interviewed, we want to reduce the number of people that go to hospitals. Even though we're in the hospital system, we don't want people to have to come to hospitals. And how do we change that? Well, we change it primarily by collaborating with the educational system to create an environment of wellness and prevention. That's the 2 keys. It's a lifestyle change that every community should consider going through. It is not difficult, particularly in Miami, where you have multicultural, you have a large number of cultures operating here. So we work closely with our internal group that educates on wellness and prevention. We have 15,000 employees, most of which are participating in that program. And eventually it has to get down to the children, about nutrition, about taking care of themselves, being active, et cetera. And that happens in Dr. Carvalho's environment. That's where it has to start. We fix people that are already broken. What we need to do is preventive, make sure that we minimize the problems that people have during the life cycle. Inevitably, we all have to move on, as they say, but there's a lot that can be done in the front end to educate our children.
Absolutely,
our
to improve the quality of life. Dr. Viamonte Ross, when we look at this, as you were first State Surgeon General and first woman, a Cuban-American woman, to head the Florida Department of Health from 2007 to 2011. There's no question that there's a critical local component to this, but there's also an important state responsibility. I want to get into personal responsibility later, but from the state perspective, and Alberto Carvalho was talking about and how difficult it is, and I cover what happens in Tallahassee to a great degree as well. This either-or proposition that it's we are either going to focus on healthcare or we're going to focus on education. Not easy choices to make, but yet at the same time, how can you really look at it that way? They have to actually be joined.
Absolutely, Helen. And I just wanted to add, it's not just at the state level, but look at the national discourse as well. Are we going to fund student loans and college loans, or are we going to dip into the prevention funds? So it should not be an either or. I'm sorry?
Go ahead, keep going.
Okay. Health and education are inextricably linked. And while I was at the state, I wish I could have said that as many people in the legislative process were as insightful and as enlightened as Senator Rich, but unfortunately I cannot. She understood that we needed to invest in our children early on. Healthy people has been mentioned by many of the panelists as well as by Maricel in her opening comments. do not suffer from as many health inequities and chronic diseases as individuals that do not have good education and good health literacy. So they're inextricably linked, and they should not be pitted one against the other. I wanted just to add to something that George mentioned. The investment that Baptist is making in primary care and prevention is manifested with an affiliation that they just formed with Florida International University School of Medicine just this past year, which I'm very honored to teach at as well. And they are starting a new primary care family medicine residency program because they understand the need for the need for primary care physicians in our community. So they will begin that soon. And the other way that they're actually investing not just into their worksite force is from a preventive standpoint, but being a model for the rest of the community is in their worksite wellness programs, and understanding that chronic disease is really going to affect 7 out of 10 of each of us. It's going to account for about 75% of all healthcare expenditures in our country. And again, prevention, let's just not speak it, but let's walk the walk. Let's just not talk the talk. Prevention is key. We currently do a lot of lip service, both at the state level and at the national level, our legislators, but in fact, 1% to 2% of our whole over $2 trillion healthcare budget is dedicated to public health and for time-tested preventive measures, from immunizations to smoking cessation programs, to nutritional activities to prevent obesity and to curb obesity in all of our communities. So let's be a role model, like has been mentioned many times. Let's link a good education to good health care and make sure that prevention is the key.
And I'd like to open it up now to the whole panel. What about the issue of personal responsibility? I mean, we all know that, that healthcare is important. We know education is important, but there's a personal responsibility and commitment to this as well. So how do we achieve that? You can't mandate that. Dave, I'm going to point at you.
I agree totally with the subject of personal responsibility. You need to think of this in some ways in terms of supply and demand. You'll never create the supply of high-quality basics until you can create the demand for this. So I'm using parents at the core of this. A caring, knowledgeable parent is the single most important ingredient in children being successful. If you know how to go to Publix or Sedano's and use a child in a cart as an early literacy experience, shapes, sizes, colors, numbers, whatever, you've got a lot better shot. If you know that TV is a malevolent babysitter for a child because there is no interactivity with television. We need to spend a lot more time on public and parental awareness. They love their children, they truly do, and if they knew what to do frequently, they would do it. So we ought to be having throughout the state what we have in Miami-Dade, 24-hour phone lines in 3 languages, a high-quality internet-based website so that you can get help in everything from how do I sign up for health care, what is good child care, and on and on. So a huge emphasis needs to be at this personal responsibility level, but you need to have the basics there that people can actually access.
Dr. Carvalho.
Thank you. When you talk about personal responsibility, I actually interpret that as personal, individual responsibility, but also personal responsibility in the shape not only of Tallahassee mandates or federal mandates, personal and individual governmental responsibility at the local level. And I think the theme for your convening today, 2020 vision for a resilient community, right? 2020. It certainly speaks to vision, but I'm thinking about 8 years from now, we're in 2012, 8 years from now, what kind of community do we hope to be? And here's what I see right now, which I consider are the biggest challenges and roadblocks to progress towards that ideal community we want to be. And the ideal community we want to be is a community, as David said, and I say it all the time, a community where parents, the stakeholders in our community, in fact, drive reform, demand-driven reform. To achieve that, people need to know and be empowered with the ability to know what to ask for. And I'll tell you one thing, and I don't speak in half tones. You go to Liberty City or Florida City or Homestead, and there are a lot of communities, a lot of parents, the migrant community in Homestead, right here in Liberty City, where the parents want to do well by their kids, but they do not know what to ask for their kids. So this issue of individual empowerment as a means of overcoming the challenges that in many communities, in many instances right here, are historical in nature, you need to empower the parents, you need to empower our clients, our stakeholders of our community with the ability to know what to ask for their kids. By the way, that has been the theory of action that has improved our public school system. Help parents navigate the system that serves their kids. Make parents menacing entities to me personally so that we need to do better and more for them. We did that through the Parent Academy. Courses directed parents to help them navigate this public school system. But when I talk about the challenges in our community that in some ways prevent us from getting to where we need to be, is the fact that governmental entities, social agencies, the philanthropic community, all of the 2,000 plus not-for-profits that concentrate on issues of health and education operate in many ways in disjointed, disconnected ways. And the energy that's lost in that friction and that lack of communication is unserved where the need is felt the most. So here are two quick examples from my perspective. We have 34 cities, all taxing independently. You have county government, you have the school board, all taxing independently. We have all these agencies that solicit grants and funds from the federal government, from the state, and from independent foundations. And what we lack is one big table where we put the need and that vision of a 2020 Miami date, and we ask the question, what do we want by them? And force everybody who has the power to legislate, the power to tax, to come to that table and agree on a master framework for the community that we envision at a social level, at an economic level, at a political level, all levels. We have the power to do this. And there are enough seats at the table for everybody to actually fit. The reason why we don't do it is because we decide to operate in silos. And when you operate in silos, you waste money and you waste opportunity. That is why the power of partnership, and I have a lot of partners on this table. And partners, by the way, in my book, I got approached by a lot of business partners. They want to come in and sell me something. My wife is my partner. I don't pay her. Okay, let's be real. Partnerships are developed as a result of people coming together and generating mutual benefit. So the Children's Trust is a partnership. Because when David Lawrence talks about 165 schools, that's 50% of the schools in Miami-Dade having a Health Connect presence with a qualified health care provider that engages in preventive care. That's a partnership. What Dave didn't say, and I think he meant it, is we still have 50% to go. It should be an either or. Partnership with Children's Hospital, with the University of Miami, where we're opening the first ever clinic in one of my schools. I am closing some schools. I'm monetizing the space as a direct benefit to the community and to my workforce. I don't want to pay the profit every single day that I pay for health care. I want to do more preventive care. So let's open jointly healthcare clinics in my schools and direct my workforce to those centers and the community around those centers into those centers to reduce cost. So there are better ways of doing better work, but it takes everybody concentrating on the master plan for our community at all levels.
You're talking about charter reform, profound restructuring of county government.
I'm talking about not just charter reform, I'm talking about community reform that is demand-driven, that is strategic, that highlights community needs and opportunities, economic growth, job development growth, healthcare opportunities, and education, all in one manifesto. We have the ability to do that.
We spend a lot of time. Which is profound charter reform.
I'm trying to stay out of that county conversation.
Donna Shalala, you travel everywhere. And this is something everybody here, we all talk about this, and it's not a new topic. We are a fragmented community, a wonderful community, a diverse community, but a fragmented community, which compounds these problems even further. how charter reform's been suggested, and I would say many people, if not all, would agree. How do you bring about the social reform? First of all, do you agree with that, number one? And number two, how do you bring about the social reform that comes later?
Well, you know, unless you see charter reform of going back and creating a real metropolitan government, you can't solve the integration problem as easily. The challenge for all of us is that our funding streams cause the fragmentation in healthcare in particular, but also in education. That we develop silos because that's the way the funding comes in. And our challenge is to look at it from the point of view of the patient, of the child as the customer of the system, and to make certain that whatever challenges we have, the healthcare system in particular is seamless for them. We can make all the investments we want in primary care, and we have to make a lot more investments in primary care in our community. We have to link them together so no one falls between the cracks. And that means that everybody gives up a little of their autonomy. And then we have to make certain that the healthcare system is seamless for everybody in our community. The truth is, it's not seamless for people that have insurance. You've got to be able to get from primary care, no matter what the organization of it is, George, I think, and to a specialist if you need to get a specialist. And that requires a kind of community leadership that we're just beginning to build, in my judgment. And until we do that, we'll still have people falling between the cracks.
And who spearheads this?
Oh, I think the Health Council spearheads. Mm-hmm. This is the place where we convene the leaders of the health community. And the key to all of this is, from my point of view, is that we're about to see a lot of money come into healthcare to take care of a portion of the uninsured, but it certainly will cut down on the number of health insured in our community. And unless we build a whole system around that, we won't have the opportunity of being able to say in this community, no one falls between the cracks and everyone gets to a healthcare home at the right time in the right place.
And what about going back for a moment to the issue of personal responsibility?
Well,
and if you've got to educate the parents as well as the kids, then I mean, we all have to be educated.
Yeah, health education is critical to all of this. It's critical to keeping healthcare costs down because we want to make sure people get to the right place at the right time. It's critical for people to ask questions to their healthcare provider. It's critical. It's critical for people in raising families. If everybody in our community didn't smoke, ate right, and exercised, we'd have enough money to take care of the health and education in our community.
That's astounding.
If we did those three things, and fundamentally, these are public health challenges that require every employer, every institution in the community to make a commitment to educate people and to begin to change people's behavior.
Dr. Villamonte.
I wanted to add from a personal responsibility, when I was up at the State Department of Health, the three themes were the 3 Ps of prevention, preparedness, and personal responsibility. Having said that, however, I think it is the obligation and the responsibility of government and community organizations to provide the opportunities so that people can make the right choices. If an individual in an underserved area, as many of you know, do not have good access to local fresh fruits and vegetables that are affordable to them, it is our responsibility so that they can make the right choices to perpetuate the ability for them to find those things. As I mentioned, personal responsibility, and I wanted to give you an example because I know we have so many challenges as a community, but let me give you some examples of really great success stories. The Camilla's Home, that many of you are aware of, the homeless shelter program that I'm incredibly honored to serve on their board, but I've been volunteering there since I was in medical school. Camillus right now, if for any of you that are interested in knowing this, has something that's called the man behind principle. And what it is that they're so determined to break the cycle of homelessness, of chronic homelessness, and really incentivize, enable individuals to embrace independent living, that currently in Miami-Dade County right now, we have less than 1,000. We have about 800 chronic homeless people in total. 10 years ago, we had over 10,000. And that is because we have not only been very successful in funding opportunities, our homeless trust has been very successful, but because I think from a personal responsibility standpoint, we've recognized that we want to help those that want to help themselves. And for the wellness programs that I mentioned just a moment ago, in any organization, to incentivize your employees to want to become healthy, to not have co-pays when they are involved in preventive strategies to maintain their health. But again, you need, in order for personal responsibility, which is at the crux of anything, to take hold, you need to make sure you give those individuals the knowledge and the ability to make the correct choices. And that's where our government and our community leaders come in.
When we, and I want to tell the audience that in a couple of minutes we're going to open it up to questions from the audience. So please, if you have questions, keep them in mind, and you can come up to the microphones so that you can address our terrific panel. George Foyo.
I just wanted to add the fact that the business community plays a huge role in this. You know, we've talked about education through the educational system and the healthcare system and the importance that they play in the overall healthcare and of the community. The business community, at the end of the day, are the ones who pay to a great extent the healthcare costs of the employees. Less and less over time as the economy has gotten worse. But for example, we pay 80% of the healthcare cost of our employees. What we're doing, as an example, for personal responsibility is that we're incentivizing our employees to participate in the wellness program, and they get a credit towards their healthcare costs, their insurance that they pay. And in this manner, they go through screening, they go through exercise programs, and our intent is over time, and I think we've already saved like $17 million through this program, which started several years ago. We believe that this can be replicated in any organization that is interested in supporting that kind of activity.
Now, George Foyo, Baptist is a large organization, but Miami-Dade County, and indeed all of South Florida, is really a mom and pop shop economy. How can we translate that type of success story that you have at Baptist for very small organizations?
Well, you can do that easily through business associations. You know, you can pool your resources. For example, the Greater Miami Chamber of Commerce or any other chambers of commerce where a lot of these small businesses congregate could work together with healthcare organizations to create these programs for their employees.
Dave Lawrence, juvenile diabetes is on the rise. There's something that we can see that environmentally, we're doing something wrong when it comes to our environment and the way we're raising our families. And I would just say that especially with Hispanic children, the rise of juvenile diabetes is statistically, the numbers are astounding. How do we turn this around quickly before it becomes an epidemic?
I'm now at an age where I don't answer questions where I don't have any real wisdom. You ought to ask Donna Shalala, who has national experience on this, the question, because I think it's a terribly valuable question, but you'd get a smarter and a wiser answer from her than from me.
The buck's been passed. Okay, so Donna, how do we do that? I mean, especially in our community where Hispanics are the largest minority.
You know, the relationship between nutrition and obesity and diabetes is very clear. Certainly for adult diabetes, we have to do everything we can to make sure our kids grow up healthy. And David and Alberto, all of us have talked about that. And eating right is part of that. We've got busy parents, and exercise is another part of it, and stopping them from smoking. or any kind of behavior that affects their health.
But you know, Donna, what you're saying is so true, but there's such fundamental truths. How do we make that a reality? I mean, if you tell anybody who's smoking it's bad for you, or you should really be walking instead of always sitting down.
Well,
how do we make the lifestyle changes?
Every single one of us are incentivizing our employees not to smoke. We're charging them more for their health care. You'd be amazed what effect that has. I actually, every time I walk by someone that smokes, I tell them it's bad for their health. And I keep doing that, and I've been doing it for 20 years, because every year I get at least 3 letters from people that said that's all they needed. They go home and their spouse says, you know, she's absolutely right, you ought to stop smoking. And all of us have smoking prevention programs and opportunities to help people stop smoking. We also have to make it easy for people to exercise, whether it's walking programs. One of the things we found out at the University of Miami is a lot of our employees can't go over to our wellness centers and change their clothes and go through all of that. So walking programs within buildings, competitions, everything we can do. But the supervisors have to release people to take those breaks. And some of our biggest challenges are in our own medical school, because people are working all hours and they won't let people off for a half hour to go get some exercise. They eat at their desks, which is the worst thing that you can do.
That's really bad.
So every employer, whether they're small or large, can look at their own facilities and give people an opportunity and incentivize them. Most of us give discounts on our wellness programs as well. Incentivize them. The Mayo Clinic last year, I think they collectively lost something like 250,000 pounds through their programs. But everyone has to look at their own situation and think through what they can do to help their employees and their employees' families.
And set the example for the kids. And then Dave, and then Alberto, and then
So
Dr.
let me add this from my own personal experience. I started smoking when I was 15 years old. It was not that unusual. It was before the Surgeon General's report of 1964. I smoked for 20 years. We were about to have the third, now the middle, of our 5 children. I wanted to make sure that I grew up to see my children. And it was because I knew I was doing something stupid. Anybody who's ever smoked here knows how deeply it captures you.
And how hard it is to stop.
And how desperately hard it is to stop, because you associate certain functions with smoking and so forth. We have to make this, we have to drive the message home more personally than we do of the consequences. Donna Shalala tells you what she does with people. I do the same thing. And I would love to sort of shake, but not in a cruel way, a teenager. I see teenagers smoking, particularly girls who do it more and more. Part of it has to do with weight control or whatever. And I say, my God, do you know what you're doing? And both my mother and father died from cancer, clearly brought on by. My mother had smoked so much, lived till she was 86, had emphysema, and smoked when she had emphysema. That's how badly it gets human beings. We need to make this a whole bunch more personal, whether it's obesity or any of these issues, so that people really know what the consequences are for themselves.
Actually, we've done a pretty good job in reducing the number of teenagers that are smoking in this country. It actually has gone down, and Florida itself has run excellent campaigns. I just wanted to point out to David that I started smoking as a college newspaper editor because I thought that's what journalists did.
And that's exactly why I smoked. Journalism did it to me. I remember it well. Okay.
Alberto.
Yeah, well, I've never smoked a cigarette in my life, even though over the past 3.5 years, superintendent, I've had the urge. But my father did smoke a lot, and enough to stunt my growth. I have a younger brother. Who's 11 years younger than I am, and my father had quit smoking by then. He is 6'2". So there is an impact. Look, I want to revisit very quickly 2 issues. The issue of responsibility, personal, individual, a community's responsibility, and the issue of healthcare cost. And I do think, as you mentioned, that the Miami-Dade's economy is by and large mom and pop. That has to change. That's why I keep talking about what do we want to be by the time we hit 2020, and we have to change that. But I'll tell you one thing, there is a tipping point. If large enough communities that employ individuals embrace common sense policy regarding healthcare delivery systems, if enough of those do that simultaneously, two things will happen. We will force market forces right here in our community and nationally that drive cost, and we will set an example for other entities. So here's what I'm talking about. If alone, and because we are in the same marketplace for healthcare as Broward County, if Broward County Schools, Broward County Government, Miami-Dade County Public Schools, and Miami-Dade County embrace a set of principles regarding healthcare and the way we negotiate contracts with unionized employees that force employees to understand that there's a hidden cost to healthcare that we and the taxpayers actually have to absorb, I think we can move that needle. Second, surprised nobody has brought up the fact that South Florida leads the nation in healthcare cost. And one of the reasons is not necessarily driven by the old true and tried laws of economics, not a supply and demand issue, is the issue of fraud and abuse of Medicaid and Medicare. So if we do what David Lawrence, if we do two things, what David Lawrence said and Donna Shalala, prioritize. If you simply engage in behavior modification in large scale, smoking cessation, alcohol issue reduction, exercise, nutrition. And as we talk about nutrition, folks, equitable access to nutrition is key. I can take you up and down many avenues, 7th Ave, 17th Ave, 27th Ave. You will not be able to buy healthy foods. So to make it available for people is important. But if you address those behavior modifications, if you eliminate those issues, smoking, etc., and you simultaneously aggressively come down on Medicaid and Medicare fraud and abuse in our state, you do not have to tax people more. It's an issue of enforcement and the reinvestment of that net value of dollars that you capture will address simultaneously those who are currently not insured in the state of Florida and the deficit that we continue to experience year to year in education. It's a matter of redistribution of dollars, and it's a matter of enforcement, whether we're talking about health care or abuses on homestead exemption. Fraud is fraud. We don't need to tax more. We need to be smarter and wiser about the way we utilize the dollars and force those who are scamming the system, stop scamming the system, and reinvest those dollars back into critical areas.
You know, we spend we lose $600 billion a year, $600 billion a year in healthcare fraud nationwide. That's more than what we spent in Afghanistan for the last 10 years. It's absolutely astounding. I'd like to invite questions from the audience. If there are questions from the audience, please speak right into the microphone because this is being streamed live and it is being recorded as well.
So the board members of the Health Council are standing up here, okay? So here's my question, and there's two pieces to it. Our healthcare system, at least how it's structured now, has basically created dichotomy or separation between the person who receives care and generally the person or entity that pays, so that you have an insurance company or some other third-party payer who pays for the care. So in thinking about that, it reduces an incentive. For example, a lot of the discussion is taking place on smoking or obesity. We have a system that creates a disincentive because the truth is you can get care if you have insurance. No matter how sick you are, you can get care. It's generally good care if you have good insurance, bad care if you have bad care and access issues and all that. So I'm just curious as to when you have a system that has basically separated the personal responsibility of payment in relation to an insurance carrier picking up that responsibility, how do you incentivize people to get, to take care of themselves? And related to that, very quickly, I run a company that has about 200 employees in it. I charge a very nominal fee for my staff to have health care. I'm paying 90% of the health care costs of my staff, and it's an extraordinary expense. What if I said to my staff member, who is a 3-pack-a-day smoker, and I've looked at his utilization because I have a right to do that, and he utilizes services at 3 times the rate of my average staff member, and I said to that person, I'm going to charge you more money because you don't take care of yourself. You've chosen not to exercise personal responsibility. How do you all feel about that?
Well, the courts may feel somewhat about that. This is a very tricky issue. We can charge people more who smoke. We cannot, within our own organizations, charge people more based on their health care characteristics. Now, obviously, insurance companies can make adjustments, and that's why we have a lot of people outside of the insurance system because they have pre-existing conditions. So we have to be very careful about whether we're going to give people physical exams and say, because you're going to cost me more, you're going to have to pay more. But what you're really arguing for is consumer-driven plans, giving people more skin in the game. And while some people believe that the slowdown of healthcare costs down to 4%, the lowest growth in 50 years of healthcare, some people believe that's directly related to consumer-driven plans. I would suggest to you that while consumer-driven plans may work for employers who have essentially middle-class employees, who have the resources to absorb some of the cost shift to them, and their behavior may in fact change if they have a little more skin in the game. Those of us that are interested in healthcare rather than just finances want to be very careful about that. What we don't want to do is incentivize people not to go to the doctor when they're sick early enough. And particularly for low-income, working-class people, marginal income affects their behavior, and all of our experience is that you've got to be extremely careful not to slow people down from getting to the healthcare system when they need to get to it. So while I'm perfectly willing, and certainly the University of Miami has a little bit more of the consumer-based plans, the fact is we have very few low-income workers, because like every other large institution, we contract out for things. So it seems to me that there's a balance here we have to achieve. I accept the principle that people have to think more about how they use the healthcare system. They have to be better educated. And if I might tell one story about this, this is true of low-income people and of the elderly. When Medicare first agreed to cover flu shots in the early 90s, the department ran a big campaign and said to all the senior citizens in the country, hey, you can now get flu shots and Medicare will cover them. The first year we had a 5% take-up. So we ran these huge advertising console campaigns, and maybe we increased it by about 10%. So we went and we did focus groups. And here's what senior citizens said to us. Because the federal fiscal year started October 1st, that's when their $100 deductible started. And so we wanted them to take their shot in October, and seniors said, hey, I saved my deductible for something important. And therefore, they put off getting the flu shot because they had to pay out of pocket for the flu shot. Now, who in the world, Anna, ever connected the beginning of the federal fiscal year with a public health issue? Sure. But the deductible turned out to be saved for going to the hospital or something that they considered more important. As soon as we exempted the flu shot from the deductible, we got the big take-ups. And what that tells you is that you've got to understand the population that you're talking about when we talk about consumer-driven plans, high deductibles. And those of us in healthcare have to be very careful that what we're not doing is building up a wall. We have some consumer-driven plans, but we buy out the first $500 or $1,000 so that no one slows down getting to preventive care as quickly as they can. And I think it's a very careful balance for those in healthcare. And I hope that as we discuss finances, we're thinking about quality health care and access for people.
The word
because that ought to
quality
be our
isn't
first
used
priority.
the word quality in healthcare isn't used enough. Dr. Villamonte Ross.
Yes, I wanted to answer a couple of questions. One is, it's perversely incentivized for the providers of wanting to do more and more procedures in order to get reimbursed rather than keeping your patients healthy. So that whole reimbursement structure needs to change. That mentality has to change. I wanted, though, to give a plug to the Miami Matters website and many of the data mining websites, because that's what informs our community and our stakeholders of what to do. When you asked about the diabetes and children, the obesity rates, and if you go to Miami Matters, you'll be able to see in a very granular manner the local data for us. How many of you know what the percentage of adult obese and overweight individuals in Miami-Dade are? 70%. 70%. So that's at the crux on a lot of the diabetes discussion, especially of children. It was unheard of to see children with adult onset diabetes, diabetes type 2. Now that's the most frequent type of diabetes seen in our pediatric group. But what's important also in Miami Matters, you'll see that not only do you have the data at the local level, but you'll be able to link to best practices that are proven to work around the country. And if you see, let's say in New York City, that had an incredible campaign, not only to address the nutritional content of foods at schools, do BMI testing for all the children and make sure that the parents were educated. Physical activity was, again, brought into the schools. Between 2006 and 2011, they achieved a 5.5% decrease in BMI across the board. It's the largest study done in a cohort of children, pediatric, for grade K to 8 in New York City, showing that prevention works, that best practices work, that we know what other people are doing, other communities are doing, and they're being successful at doing it. So I urge you to go back, look at Miami Matters, not only to understand what your community needs are, but what has worked elsewhere, and even here, and we've achieved good results.
One last question.
Yes, Deborah Walker. I'm a Health Council board member and retired school board member from Monroe County. I recently had a conversation with a University of Miami medical student in the Keys at a doctor's office, and it got rather heated. And I finally asked him, well, do you believe healthcare is a public good or a private good or a private entity? And he said, oh, it's private good, private good. You know, well, my blood started rising a little. And I said, well, what about immunizations? Is there anything that has a public value? And, you know, he kind of backed off a little bit. He was pretty insistent. It's a private good. It should be bought and sold. Well, I believe that both public health and public education is a public good, and it accrues to the whole community. However, I don't believe everyone has the right to private piano lessons in education or private or liposuction or something like that. So there's got to be some sort of a line between what's public and what's private in both healthcare and education. And in terms of children's services, I wondered if you all, because you are some of the experts here, can you direct the Health Council to specific kind of strategic things that we might be able to do to draw that bright line between what is our domain and how we can help this community address that?
Great question. Donna Shalala?
Well, everything's your domain in healthcare, as far as I'm concerned, and that's the seamlessness of the system. I think you should ask the same question to the young woman that you're going to give your scholarship to, Shatira Johnson, who's here, who's a first-year medical student at the University of Miami. She taught science in the public schools. She grew up here with a single mom. She has a wonderful story, and she's now a medical student. She might answer that question differently. I'm not sure I care about the answer to the question. What I do care about, and what we all should care about, is that the Health Council isn't responsible just for prevention or for primary care. We've got to make sure the whole system is seamless. And I consider that both a private good as well as a public good.
Okay, a quick final thought and real brief from each of you, Dr. Villamonte.
I believe that there's a human responsibility to care for the least of us and to make sure that there's a baseline upon which everyone can access affordable and quality health care and education. And I think that that's our public good. The private sector is obviously an important component of that. But I think the health of an individual is really reflective of the health of the community. The failure of an individual is the failure of a community. Again, having spoken, though, about personal responsibility, we need to make sure that individuals are empowered to make the right choices and hold them accountable. But I do believe that the good of one is really the good of all, and we should act accordingly.
And good information is key to good decisions. George Foyo.
I think it's extremely important that we move from fee-for-service to value purchasing, which is quality-based as opposed to value-based. And we firmly believe that that is going to take place. It's already taking place, and you see it through consolidation on the industry. More physicians are becoming part of hospital systems. Hospital systems are buying insurance companies and vice versa. But value purchasing at the end is really the key. And the other thing that I'd just like to address, just very briefly, that hasn't been addressed is that Miami-Dade County has 30% uninsured rate. That is a huge cost because, as somebody said earlier, everybody gets service except they get it through the emergency rooms. Emergency room treatment is the most expensive medical treatment you can get anywhere. So part of our cost structure issue has to do with uninsured patients going through emergency, and we have to find a way to get more people insured and put into the insurance pool so we can minimize the risk and they have access to primary care and have access to urgent care and so on without having to go through emergency rooms.
And George Foyo, prevention won't come from the emergency room. It's got to come way before. Thank you. Dave Lawrence.
I'd want folks to remember that there is a study that came out a couple of years ago called Mission Readiness. You can Google it or Bing it or whatever to find out more. What it says is that 3 out of 4 young people ages 17 to 24 in the United States of America cannot enter the American military. They have a physical problem, an academic problem, a substance abuse problem, or a criminal justice problem. You're talking, the issues we're talking about today, the health and education of all Americans, is a national security issue, and we need to step up our game considerably on all of this.
Thank you. Dave Lawrence. Donna Shalala.
First, let me also congratulate Nan Rich on her award as well, and also a shout out to Gwen Margolis. These are people that are longtime supporters of our community and these goals. I think the point that I would keep repeating, this community has extraordinary resources, and both in education as well as in healthcare. We just have to bring them together. We can do this. There are new resources that are coming into healthcare in particular. We need to stand our ground in Tallahassee to protect our public school system in particular. And I just can't think of anything that we can't do in South Florida if we work together.
Is the only impediment to making it a more seamless process a structural issue?
It's a partnership issue. It's actually personal responsibility of institutions and a partnership issue. And the leaders of the Health Council will tell you that. We just have a long way to go to be able to net all these pieces together so it's seamless for everybody in our community.
And like Alberto Carvalho was telling us, 2020, it's not that far away.
No.
Alberto.
Thank you very much. Well, one of the benefits of being the last one to speak in closing is that there's very little to say because I think the 4 voices before me closed it out pretty well.
Come on, give me a break. You said I asked you the hardest question first.
I will echo the sentiment that I was just expressed. I think health and education are 2 sides of the same coin. And what that coin represents is quality of life. Investing, strategically investing, not just throwing money at it. Strategically investing in education and health care is an enabler of improved quality of life. And I think that's what we want. We cannot engage and linger in the device, the sort of the conflicting dialogue that private versus public, whether we're talking about healthcare or education, puts us in. We ought to come together and navigate and build an architecture for a community that incorporates all stakeholders, brings people to the table, and develops a master plan over the next 5, 10 years that works for the community at all levels, socially, economically, in terms of healthcare, in terms of education. They are interconnected. They're all building towards the same promise, the same ability that we have as a community in delivering the best quality of life for our citizens. This is doable. All it takes is for us to go from words to deeds. I hear a lot of people often talking a whole lot and doing very little. I think this council is a great example of people who actually think about it, talk about it, but you are practitioners. Mm-hmm. You actually do the work. I think we need to expand this, bring additional people to the table, and build that master plan, that architecture for a better Miami, for a better South Florida. We can do this. All the people that have the skill set, have the solutions, have them in their minds. It's a matter now of bringing those intellectual solutions into practical realities.
And every family brings together our community, and a community is our public good, that we have to work very hard to maintain and ensure that it stays healthy. Thank you to everybody who's joined this panel. Join me in thanking them with a round of applause.
Thank you very much, and it's a great honor. And you saw some of the accomplishments of the Health Council, and we are just conveners. It's you that actually make a difference. It's our privilege to be able to have you come and join us at the table to help seek the solutions that South Florida needs. And we can't do it without partners. You did see you did see some of the partners that have helped us achieve what we've been able to accomplish over this last year. But right now is the time to also celebrate other partners that we've had and other leaders in the community that are of significance to health, to children's issues, and to education. Right now it gives me great pleasure to announce and introduce this year's award winner for exceptional public service, the Honorable Senator Nan Rich. Senator Rich is well known to all of you, and we do want to congratulate her. She was elected to the Florida Senate in 2004, subsequently re-elected again in 2006 and 2010. She was voted by her colleagues to serve as the Senate Democratic leader from 2010 to 2012. Throughout her tenure, she has established a reputation for being one of the most passionate and dedicated members of the Florida legislature. She is widely recognized as one of Florida's leading champions of children's and social issues. Prior to her election, she served as the national president for the National Jewish Council, the first Floridian elected to that office in the organization's 116 years. She has extensive experience in advocacy and community service, and she's worked to improve the lives of women, children, and families in her community, the United States and Israel. In 1999, then-President Bill Clinton appointed Senator Rich to serve as a board member for the United States Holocaust Memorial in Washington, D.C. Senator Rich's community experience includes years of advocacy and activism on behalf of women and children. She currently serves as the board of directors for Kids in Distress, the American Jewish Congress, the Southeast region. She founded the Guardian Ad Litem program, the Guardian Ad Litem program for Miami-Dade County, and she is founder and past president of Charlie, which provides residential homes for abused and neglected children, and is a founder and past president of Resource Mobile, a project that trains family and child care providers. The Health Council is honored to recognize you, and we thank you for your dedication, and we know that we have many more years to count on you for children and health care needs. Thank you, Senator Rich.
Well, thank you so much for this wonderful honor. I just have a few words that I'd like to say. I've been taking notes while the panel was up here because I didn't really prepare much. But I have to say that going back to the very first words that were said by the panel, education and healthcare, it cannot be an either or. And it doesn't have to be. Unfortunately, over the last number of years, this legislature has elected to make it an either or. But it does not have to be that way. We have a $70 billion budget. It was mentioned you could take money away from roads or you could take money away from somewhere else. You can't. And I'll tell you why. Because if I look at the budget, and no one has mentioned seniors really today, only 2.6% of our general revenue dollars go for seniors. We have over 4 million seniors in the state of Florida. They're all part of the comprehensive planning that you do as a part of the Health Council. We can't take money from them. Our roads are important. Our schools are important. Health care for children is important. We have the third highest number of uninsured children in the nation. Over 500,000 in this state don't have health care. I have to say that this year it's kind of painful because I worked hard to get a bill passed for the last 3 years to allow children of state employees who are otherwise eligible to be able to access and become a part of the Kid Care program. Well, I got the bill passed for the second year in a row in the House, 40-0, in the Senate, 40-0, but the House never took it up. We finally put it into the conforming bill, and the conforming bill passed. Guess what else was in the conforming bill? The Medicaid billing issue for the counties, which there is a lawsuit right now. So it's kind of a painful exchange for me, but when I look at the importance of the prevention aspect that all of the members of the panel were talking about, this state does not have a commitment to prevention. We had to fight this year for Early Steps program, that's the 0 to 3 component for developmentally disabled, for Healthy Families, which is a best practices program. It's a model that's used around the nation for Healthy Start. But we also had to fight for dollars for community care for the elderly, for home care for the elderly, while we were cutting provider rates for hospitals and nursing homes. And I don't have to tell most of you what was going on with education at the same time. And I want to just say, you know, we can do better in this state. We are a rich state. We're not a poor state. And we can't allow anyone, whether it's the executive branch or the legislative branch of government, to tell us that we can't adequately fund both of these critical issues for the state. And I think that this is, lastly, I just want to say, we had a wonderful group of people. A lot was mentioned, I think over here, the former school board member, about public education. We had a group come up because we had a terrible bill, the Parent Trigger Bill, that was supposed to allow for-profit charter management companies the ability to take over schools that are paid for by you and me, by the taxpayers of our communities. And we had the most incredible advocates come up to Tallahassee, organizations from all across the state. And we defeated that bill. My colleague Gwen Margolis is here. We defeated that bill 2020. It's about as close as you can get. But I maintain that we did because of the outcry by the parents who want strong public education. It's the same thing with you. You want comprehensive planning, programs, services having to do with healthcare, but linking together with education. And lastly, I want to remind you that we have got to take every dollar that the federal government makes available to us for healthcare. We are not doing that in this state, and you can applaud, because we have lost hundreds of millions of dollars that are our taxpayer dollars. We lost last year $37 million for Money Follows the Person, which is a program the federal government funds and grants to allow frail elderly to be taken out of nursing homes, those that can, and be put into, stay in their own homes, community-based care. We had a maternal infant child health program that we turned down the money. The good news is that, and you all probably know this, $21 million, $21.4 million just came to the state this past week. And you know why we took it? Because it went directly to local communities. It bypassed the federal government. Smart sometimes. It bypassed Tallahassee, and it went directly, and several community health care centers in our community here in Dade County are the recipients of that funding. And we just have to let, and everyone has to let, the legislature and the governor know that we deserve that money. Just because they're involved with the lawsuit on the Affordable Care Act does not mean that we should not take the money that is being given to states all over this nation, including a state like Texas, who's also a part of this lawsuit, but they're taking every dollar they can get their hands on. And we need to do the same thing here because we deserve it, we've paid it, and it's our money. So I urge you to kind of remember that and use that as an advocacy tool. And I thank you so much for this award. I am term limited, so this was my last legislative session. But some of you may know I have other plans within the next 2 years. And I'll be seeing you around the campaign trail. Thanks so much again.
Discussion earlier. So now we're going into our scholarship award, and I'd like to call up to the podium both Martha Sanchez, who is the Vice Chair of the Health Council's Policy Planning and Advisory Committee, and Yvette Mainquist Camejo of United Healthcare Community Plan to present the scholarship award, please.
Good afternoon. Thank you all for joining us and hanging in there. I know it's been a long afternoon, but this is a very, very important session, and the information we received today was very valuable, and this scholarship recipient will very much appreciate your presence here. The Health Council of South Florida the Health Council of South Florida Scholarship Award was established in 2009 to address the shortage of healthcare professionals in the community, specifically in the area of primary care. The Health Council partnered with all local medical and graduate nursing programs to ensure equal opportunity for all students from the various academic institutions in our community. The Health Council is pleased to have partnered this year with United Healthcare Community Plan, whose mission is to help people live healthier lives by ensuring access to high-quality healthcare services for the underserved. And this is in alignment with the mission of the scholarship. This year's winner has demonstrated great potential and an admirable passion and dedication to community service. It gives me great pleasure to announce the 2012 Health Council of South Florida and United Healthcare Scholarship Award recipient, Shantira Johnson, formerly a middle school science teacher. Shantira went back to school to pursue her dreams of becoming a physician. She is currently a first-year medical student at the University of Miami's Leonard M. Miller School of Medicine. In addition to all of her academic achievements, Shantira works with the University of Miami's Community Outreach and Teaching Services, or short for COATS, a student-run organization which gives secondary school-age children an opportunity to learn hands-on about the human body and to see the harmful effects of an unhealthy lifestyle. I now invite Shantira to come forward and to be recognized.
Thank you. I see I get a plaque too. I'm so excited about that. I just prepared a small speech. And it just goes, a historical figure is quoted in a very popular book to have said, "It is more blessed to give than to receive." And I agree. You see, I've been in each role, and I must admit that in each setting, it felt great to be honored, but the gifts always meant more when I gave them back. I'm a product of the Miami-Dade County Public School System, and for 13 years, this district's teachers gave me the great gift of education, an education that allowed me to go on and become the first college graduate in my family. After graduating from undergraduate school, I served as an educator of the Miami-Dade County Public School System for 7 years. 2 of those years was at a middle school I attended as a student. Now I am receiving a wonderful medical education at the University of Miami's Leonard Miller School of Medicine, an education which you are helping me to fund, Health Council of South Florida. Today you are the giver and I am the receiver, but one day you will reap your reward when you learn of my service to South Florida's medically underserved communities. I thank you for sowing into my life, Health Council of South Florida, and your seed will harvest a healthier community. Thank you.
I just want to say that Shantira had said to me she felt like a star when she looked and saw her picture in the program, and I just want to say that she and Yvette are both my stars.
Thank you.
And now, without further ado, Nelson Lazo, our incoming board and chair.
I was 20 years old, seriously, when I got here. Listen, I'm honored and privileged to be the chair of the council. I have a really hard act to follow in the wonderful work that Jose has done and the folks before me. But I do have a terrific board, and the folks at the council are outstanding, and you've seen it today and all the work that they've done. I'd like to give out some gratitude, of course, to our sponsors for all the support in making this event a reality today. I would like to thank everybody that attended today for supporting all the Health Council initiatives. I would also like to thank all the volunteers, the community leaders, the elected officials. Working together, we can build a more resilient community for our future. I want to thank Maricel. I've known Maricel for many, many, many years, and I really appreciate the dedication that she puts forth for the council. The team of caring, valuable individuals within this organization that do a great job on a daily basis and bring all the things that we do in the council to fruition. And I'd like to especially thank the board of directors. It's an outstanding group of folks. They do this on a voluntary basis, and they work extremely hard, and I'm very privileged to have them as my board, and I'm very privileged to have worked with them in the last couple of years. I'm very proud to say that the council's accomplishments are at the forefront of the health planning of South Florida. The council continues to fulfill its mission in an unbiased collection of resources, of health data, of quality program planning, management, evaluation, strong partnerships, both in Miami-Dade and Monroe County, and target healthcare policy at the local and national levels. One such accomplishment, as you heard earlier today, is our 2nd anniversary for the launching of Miami Matters. That has furthered our ability to disseminate information current and unbiased to the community. As a devoted community partner, the Health Council of South Florida is engaged in addressing some of the most critical issues affecting healthcare and wellness of all the recipients of Miami-Dade and Monroe County, such as the adequate access to care, reduction of healthcare disparities within minorities and immigrants, and improved promotion of health and wellness education to a diverse population. Our board of directors will continue to focus public attention to these priorities over the next year. Please make sure to mark your calendars for next year's luncheon, which will be May 2nd of 2013. So it's going to be very hard to top today's agenda, which is a fabulous event here today. I also urge you right now, ladies and gentlemen, I've been given the privilege of doing this, to look under your seats, as you will find, give away the lovely centerpieces adoring our tables today. So please, if you have an opportunity to do that, there's some tables in the back with no one. Do not rush and take those. Don't embarrass yourselves. But anyway, in closing, we are proud to be part of the South Florida community that cares. As we move forward, let us, as a community, renew our commitment to partnership in collaborating and addressing the needs of Miami-Dade and Monroe County. I am privileged to be the board chair. I am privileged to work with this board. We're going to do tremendous things for this community, and we had a great program today with very relevant topics that I really appreciate our panel addressing today. So thank you for the support of everyone in this community. We work for you. Thank you.
Thank you so much, Nelson. Thank you so much, ladies and gentlemen. And